There's a disease America eliminated 26 years ago. It's not supposed to exist here anymore. But right now, in the summer of 2026, it's spreading faster than at any point in the last 3 decades. And most of the people getting sick are kids. We're talking about measles. And the numbers that just came out should stop you in your tracks. The CDC confirmed this week that the United States has officially blown past last year's measles case count. As of late July, there have been 2,318 cases nationwide. To put that in perspective, this is the worst year for measles since the disease was declared eliminated in the US back in the year 2000. Eliminated. Gone. And yet, here we are. So who's getting sick? The vast majority of cases are in people under 20 years old. And almost all of them are either unvaccinated or their vaccination status simply isn't known. That detail matters because measles isn't some mystery illness we don't know how to stop. We've had a vaccine for it for decades. The reason it's coming back has almost nothing to do with the virus getting smarter, and everything to do with vaccination rates slipping in communities across the country. Public health experts have long said that once vaccination coverage among kindergartners drops below that 95% threshold, the protective wall the whole community relies on starts to crack. And that's exactly what's been happening. Here's the part that really tells the story, though. This outbreak isn't spread evenly across the country. It's concentrated, brutally concentrated. Just 2 states, South Carolina and Utah, account for more than half of all cases in the entire nation. Half. South Carolina alone has reported 670 cases this year. Utah has reported 522. Combined, that's over 1,190 cases from just 2 states. And if you zoom out slightly, 7 states make up more than 84% of every measles case in America right now. Meanwhile, 23 states plus Washington, D.C. have seen 3 cases or fewer all year. So this isn't a story about the whole country slowly getting sicker. It's a story about specific pockets where the virus has found an opening and it's tearing through them. Let's walk through where this is actually happening. South Carolina is the epicenter. 670 cases this year, up from 333 last year, and just 1 single case back in 2024. Think about that jump. The state had just wrapped up a massive outbreak in its upstate region that topped nearly 1,000 cases between last October and March, mostly among people who weren't vaccinated. They declared that outbreak over in April, and now they're already deep into a new wave. Utah is right behind them. The state had 197 cases in all of 2025. This year alone, it's already blown past 500. And this isn't just kids getting a rash and a fever for a few days. Health officials in Utah have documented real, serious complications. Pneumonia, dehydration, sepsis, even shock. Measles has a reputation for being just a childhood illness. But that reputation is dangerously outdated. Then there's Texas, which is actually a strange case. Texas had more cases than any other state last year, over 800. This year, that number has dropped way down to 188. Progress maybe, but vaccination rates for kids in Texas have been falling for years, right along with the national trend, so health officials aren't exactly celebrating. Virginia is the one that should worry you the most in terms of trajectory. Last year, Virginia had 6 cases. 6? This year? 176. Officials are directly pointing to low vaccination rates as the reason, and there's now a confirmed active outbreak spanning 2 counties, Buckingham and Cumberland. Florida tells a similar story. Just 8 cases in 2025, and now 141 this year. There was a real surge earlier in the year, though there are recent signs the outbreak there may finally be slowing down. And then you've got Pennsylvania and Arizona, which are the ones to watch right now, because their numbers are actively climbing week over week. Pennsylvania jumped from 110 to 134 cases in just the last week alone, the single biggest weekly increase in the country. Arizona added 9 new cases in the same stretch, pushing it to 108 for the year. Now here's the one number in this entire story that might be the most important and the easiest to overlook. Despite over 2,300 cases nationwide, there have been 0 recorded deaths this year. That's not luck. That's modern medicine doing its job, catching complications before they turn fatal. But medicine catching the fallout isn't the same as preventing the outbreak in the first place. A disease we already know how to stop is spreading in real time in 2026, mostly among people who never got the shot that would have stopped it. Measles doesn't spread because it evolved. It spreads because we let our guard down, and these numbers are what that looks like in practice. If you want to stay on top of health information like this, make sure you're subscribed.